Hi, my name is Madison Fluty, and today I'm going to be doing an informative speech over the field of nursing. I'm a nursing major here at TAMUCC, and I'm going to tell you about the different fields that you can go in. Imagine that you're in the hospital and you have all these patients under your care, and all of a sudden one of your patients flatlines. You, as a nurse, are to call a code, but until that doctor arrives, you're responsible for that patient's life until they arrive. Sometimes I feel like nurses are undervalued and people don't truly respect that they're the backbone of the hospital. In nursing, there's a lot of different degrees that you can go into and a lot of different things you can do with those degrees. Starting with the bottom of the food chain, there's the Certified Nursing Assistant, otherwise known as the CNA. The great thing about a CNA is that it's only a 2-year degree that you can usually get at a community college or anywhere that offers associate degrees. Basically, the job description for a CNA is that they're the eyes and ears for whoever they're attending to, whether it be in a hospital environment, a nursing home. They basically are the eyes and ears for the RN. They're the ones that are going to directly be with the patients a lot of the day and walking around and see how they're doing, and they report anything back to the RN that they deem necessary. From then you can go and get an RN degree. This is one of the top 10 occupations with the largest job growth. An RN degree is 4 years, and basically there's a lot that you can do with an RN degree. You can go into more the management side of things, where you're going to be doing more research and you're going to be in charge of the RNs on the floor, and you're going to be making sure that all the practices are followed accordingly. Or you can do the more patient care side of things, where you can make basically like wellness plans, and you're going to be giving out the medicine that the doctor prescribes, and you're going to be discussing with the patients what they need to do with the medication and make sure that all the family understands. The thing about RNs is that they recently have gained notoriety with working with the doctors, and that they truly are, like, their opinion should be respected, and they do have something to add to the mix. If you're an RN, you also have the ability to go for higher up degrees, such as a nurse anesthetist and a nurse practitioner. We're going to start by talking about the Certified Registered Nurse Anesthetist. This is an advanced practice that works with healthcare professionals. A nurse anesthetist, you're going to expect to go to school for about 7 years, but with this, you're going to gain a degree that you're able to do a lot of things that a real anesthesiologist would, besides the fact that you haven't gone to medical school, so you're not going to, you're not going to make the same amount as them, but you're able to. These are especially valuable in like the rural communities or in the Army. They choose to use these nurse anesthetists that are, they reduce expense to patients and also to insurance, so they're a really great option for the more rural communities that are looking to save money and offer care to everyone. And then moving into a nurse practitioner, this is basically an RN that's completed advanced coursework. They really have an independent role because they're able, unlike an RN, to prescribe medication, and in I think it's about 27 states they're able to run independently, like their own practices, such as like urgent cares, or they can partner with doctors and run different doctors' offices. And their main thing is that they can diagnose and treat acute illness and injuries, which is a big difference, that they really more function as a doctor do, but so they have a lot more of like a management position. The great thing about a nurse practitioner is they don't have the crazy hours that doctors do in the hospital, and they're able to do more like doctor's office sort of thing, and so they have a lot more flexibility to be able to raise families and have a more regular schedule. Personally, I'm doing nursing, and I've chosen to hopefully go into a nurse practitioner program after I graduate from nursing school. This is the field I chose because it's really important to me to have a family and be able to do things like that, and this is like I'll be able to do those sorts of things. Nursing, no matter what degree you choose out of all of these, it's a great and growing field, and it has an excellent outlook no matter what you choose. I hope this has taught you a lot about the field of nursing, and this is only a few of the degrees you can go into, but there's so many more. Thank you.